Okay. So for draping, you're going to try and have it over the knees if you can. And then you pull down here. And then that way, if the patient wants to see you, they can still see you. And if they really want to see you, you can put the head of the bed up so that they can actually see you. Then what you're going to do first is inspection of all of the areas. I'm going to move this now so that you guys can actually see. So you inspect all the external genitalia, the perineum, and the rectal area. Then you're also going to inspect sort of the internal area that you can see by separating your finger. Okay, with separating your finger. So the urethra, the labia majora, and the introitus, the vaginal introitus. Okay. Then you're gonna do the internal exam, make sure that the speculum is closed completely, so it's not latched here and this part's down all the way at the bottom. When you hold the speculum, you want to hold it like this so that you don't accidentally open it on the way in. So you hold it like that. Okay. We're using water on our models instead of lubricant. You want to tilt it this way, 45 degrees, but you also want to tilt it this way down toward the floor. So pull the labia majora apart, then you insert it down toward the floor. The plastic models you have to push pretty hard. And once it's all the way down as far as it'll go, you bring it back to 0 degrees, and then you can open it because it's going to be inside. So you open it. If you can't see, readjust the light. Then you're going to use the pap samples. So you can use this. This goes into the cervical os. So in, twist it 360 degrees, back out, goes into the fluid. Then this one, the larger part, goes into the cervical os. Then you twist it 360 degrees, comes back out, goes into the fluid. If you have this broom, this you can use all by itself. So you have to use those two together or this one by itself. It goes, that longer piece goes into the cervical os, and then you just spin it 360, and that's what goes into the liquid. Okay. Then when you pull it out, you unclick it, let the body close, the speculum, twist it back to 45 degrees, put your hand here so you don't accidentally open it, and you pull it out. As you're pulling it out, you're looking at the lining of the vaginal canal. You're looking to make sure there's no erythema, there's no lesions, looking for discharge. The next piece is to separate them. So I pulled them apart. You're going to look for rectoceles and cystoceles. So you insert the speculum. Now we're holding the rectum out of the way. We ask the patient to cough or bear down. If there was a cystocele, this tissue up in here would kind of come down toward the vaginal opening. Then you switch. You have the patient cough or bear down again, holding the bladder out of the way, and you're going to see if the rectal tissue comes from sort of posterior and comes down into the vaginal opening. So that's rectocele and cystocele. Then the next part is the bimanual exam. So the first part you did seated, now you do the second part standing. So it's 2 fingers inserted into the vagina and this hand on the outside to help you. So what you do is 2 fingers in. On these models, you may only be able to use 1. And what you're going to do is I always do the same thing each time I do it. I feel for the cervix first, which should be basically straight centrally in a little bit toward the buttocks. And then you're going to feel the fornices all the way around. So the posterior, so behind the cervix, anterior above, and then on either side. Then I want to actually feel the fundus of the uterus. So I use pushing up tension with the inside hand and pushing down with the outside hand. You'll feel the fundus with the outside hand, not the inside hand. Then you want to do each adnexa or the ovaries on either side. So you go to the one side and pushing down with the outside hand and up with the inside hand, and then the same thing. So I'll show you what I'm doing on the inside. So when you're doing the uterus, you're pushing up with this hand and down with this hand, and you're feeling it from the top hand, from on the abdomen. The ovaries, you're going to one side, push down with this, and you're sort of pulling towards you, and it should feel like a little almond on the inside hand. So like this and like that, okay? Then the rectovaginal exam is one finger in the vagina and one finger in the rectum. So it's going to be one finger here, this finger in the rectum. Doesn't work on Nurse Ann, but the other models will actually let you insert a finger. What are you feeling for? You're feeling for the rectovaginal wall, so the area between the two of them, as well as can you feel anything with the finger in the rectum, like a rectal tumor or hemorrhoids. Then the last part of that is using the Hemocult card, which is this. So you open the card, you put the sample of what was on the finger in the rectum on this, you close it up, and then you'll use the developer here, and it's like a little drop of fluid that you just put on the outside. So the sample goes here, on there, and then you develop on there. And then the only thing that I forgot that I think is on your checklist are the Skene's glands and the Bartholin's glands. So Skene's are going to be up here, and Bartholin's are down here. And then the last thing is if you suspect either a UTI or urethral discharge, you can milk the urethra. And so that's one finger in, and then you pull anterior towards yourself, and you'll see fluid come out of the urethra. And then the last piece is we use the plastic speculum on these models and the models that come for an exam but know how to use the metal ones. So they open this way, and then you screw them into place, and they open this way, and you screw that into place. So know how to work these by screwing and unscrewing and maneuvering these. Okay. So they open that way.